surgical videos, and he's going to share the secret how to make an award-winning video. I think soon after we'll have all of us trying to reach out to you for how to make an award, and please share your secrets with you, Dr. Kelkar. Over to you.
Thank you, sir. And I must share the secret, and it's actually no secret, but I draw my inspiration from none other than Dr. Joshi. So every picture tells a story, and this very simple picture of my father with the legend Dr. Joshi sir tells us the story of great friendship between the two families, Dr. Kelkar family and the Joshi family, that has stood the test of time and over the generations. So when Dr. Srinivas actually called me to inform me that I will be receiving an award at this prestigious conference, it was more like a pat on the back from my own family, and that's why this award means a lot to me. Thank you. So what is the role of vitreoretinal surgery videos, and why should you make an effort to document your surgeries and showcase it to the world? So first is of course the conferences, secondly the teaching as well as learning, thirdly the video assisted skill transfers, and also sometimes medical legal cases you might be saved by some good recordings. So always keep your camera ready, and you can always expect the unexpected at any time and anywhere, just like in this picture. So when you are creating a good quality surgical video, first to involve good content, you must have a good video capture, then transfer the video, conversion, editing, and after that then you are ready for submission. And for doing all this you obviously require good equipment and a proper technique of recording. So there are different cameras that you will get. Most popularly used cameras are the 4K cameras, which are mounted externally with the help of a C-mount. And interestingly, you might not be aware that this also has a fine focusing or XY adjustment, and in fact some of the cameras also provide you with the aperture control. Another commonly used camera is the Sony 3-chip camera, which also enhances the picture quality because it can enhance the red and blue channels almost 4 times, and that's why it has better quality of pictures. Nowadays you can also get integrated cameras such as the ones from Zeiss and the other companies, which also give fantastic clarity to your surgical recording. Another Jugaad type of a system can be a mirrorless 4K camera. You can mount it with the help of a specific C mount meant for a particular microscope, and this can be very handy on even a smaller scale setup. So the settings that you require when you use this kind of a camera is manual mode. You can have the frames per second as 25, shutter speed 40, and an ISO auto. These are the settings which Dr. Meghur sir has shared with me, and I acknowledge his help for making this presentation as well. When it comes to recording vitreoretinal surgeries in particular, you need to choose a good lens. I tend to use this disposable lens because it tends to fog less. Or if you are using this kind of a contact lens, it makes your surgical videos look really great. Now coming to the recording aspects, when you are recording a surgery, you must have the area in focus and well centered. Now this is one of the residents who's trying to induce a PVD. He's done a good job, but unfortunately everything is out of focus and nothing is well centered. So this kind of a video is going to be of no use, even if this surgery might have been extremely dramatic or extremely rare. Another important aspect that you must focus on is magnification. Look at this, fractional retinal detachment is being handled, and such a low magnification unfortunately doesn't really give the message to the audience exactly what to look for. So make sure that the area in focus, in particular what you are trying to show, has to be magnified. Make sure that you are used to operating on a higher magnification. Otherwise this surgical video could have been really great if it was recorded in a magnified view. Another challenging issue, especially when it comes to the peripheral retina, is the kind of hyperexposed, I would say, bright images that you see, and then the whole recording is totally wasted here. Here is a patient where subretinal silicone oil is being removed through a retinectomy, but unfortunately because the picture is so overexposed, nothing can be really useful in terms of presenting it in a conference or some seminar. So a proper technique is that the camera should be ready. You can also take help of your assistant Make sure that he is also involved in your recording. Make sure that the surgeries are well centered, well focused, and well documented. So if you have such an interesting picture here, as you can see, the whole bag is floating over the PFCL bubble. If it's not well focused, it will be of no use, but in this case, the whole picture is well focused, well centered, and properly magnified. This will give a good treat to the eyes of the audience as well. So after you have recorded the surgery, the next step is to transfer and convert this video. You must use a large file size and highest quality surgical videos. This is important. So you must have a USB drive that has sufficient space for the data transfer, and then the conversion software that can be used for editing these videos. So when you want to edit the video, you must make sure what you want to show has to be highlighted. So keep it precise, keep it to the point, add narration and some special effects. Try to be creative and make sure that the quality pre-operative and post-operative pictures are also incorporated, because that's the key thing that the audience is also looking for. And also when you are submitting these surgical videos to a particular conferences, try and see what are the rules and regulations. Some of the conferences may want even the copyrights of the music that you are trying to add to your video might have to be copyrighted. So when it comes to editing the video, there are various softwares available. Adobe Premiere Pro is one of the most popular ones. iMovie, I think Dr. Srinivas is very fond of iMovie. Then you have Filmora Go, and also the Pinnacle software is quite good. There is a scope for creativity for all of us. You need not be a hi-fi or a very flamboyant surgeon like Dr. Srinivas or Dr. Apurva. They can do anything and the people will definitely watch. But there is a scope for creativity. Even if you are not such a great surgeon, you can also showcase your own complications, and that's the take-home message that people can draw. There's no shame in showing your complications to the audience and to your own colleagues, and that's how they can also learn from the mistakes that you have made. So here's one of the surgical videos that I used this. Can I have the audio, please? Audio from the. So this is about a macular complication that I presented in one of the ASRS conferences.
Every night, I dream the same dream. The nightmare begins.
So these failures can also win you trophies and awards. You need not be shy of sharing your complications is the thing that I wanted to drive across. And yes, these trophies do look very amazing, but if they are shot by somebody who's a real professional photographers, they would look more amazing. So when you all great surgeons are doing your own good quality work, make sure that you record your surgeries like a pro, and then you will have a lot of trophies coming your way too. Also involve your team members. The whole hospital takes pride in having these trophies in our showcase. And it's not just the American Society of Retina Specialists or just the retinal videos that we are talking about, but our team also has won awards at the ESCRS. Dr. Akshay has won Best Surgical Video for Cataract. Dr. Zai has won at Kerakon about the corneal surgery. So the whole team takes pride, and they are all together when it comes to presenting videos, and they're all creative minds gel together and have a great time together. So when it comes to surgical videos, just to summarize, make sure there is a proper technique, set the equipments and format correctly, get clean images, pre and post included, edit precisely, be creative. You can also showcase your complications. As I said, you must have your videos well centered and well focused, and special effects and narration also add to your content of the video. So wish you all the best. I hope this talk will bring you more trophies as well, just like Dr. Srinivas is one of the legends in filmmaking. Thank you.
Thank you.